Okay, we're going to go ahead and get started. So, good afternoon or good morning, depending on where you are joining us from. My name is Therese Brown, and I'm a research analyst here at Canada Health Infoway's performance team. Thank you all for joining our webinar today, where we will be discussing digital health and information technologies in nursing practice. We do have simultaneous interpretation available for this event, so if you would like to listen to this presentation in French, click interpretation at the bottom of your Zoom toolbar, select the French channel, and then mute original audio. If you are listening in English, you do not have to do anything. Additionally, please be aware that the webinar is being recorded. The recording, along with the full presentation slide deck, will be posted on our website at the conclusion of the webinar. Prior to getting started, I would like to complete our land acknowledgement. So we acknowledge that the lands on which we gather for this event are the traditional territories of many Indigenous nations. Canada Health Infoway recognizes the profound and ongoing injustices experienced by the Indigenous peoples and what we now call Canada, which continue to impact their health and well-being. We honor the resilience and strength of Indigenous communities and their rich cultural heritage, which contributes to our understanding of improved health outcomes. I invite all attendees to reflect on the territories from which they join us. Let us commit ourselves to deepening our understanding, fostering genuine relationships, and actively contributing to reconciliation efforts. Together, may we strive to create a future of respect, understanding, and partnership with Indigenous peoples. So we've got a great agenda for you all today. Following my short introductory remarks, we will have 3 presentations. We'll first hear from an Infoway nursing champion discussing her frontline experience with digital health technologies. Following that, we will hear a health informatics perspective on the upcoming trends in nursing technologies. And to finish off, we will present results from the 2023 survey of Canadian nurses. As usual, we will save Q&A for all presentations until the end. Participants can feel free to send any questions they may have through the Q&A feature in the Zoom throughout the webinar. I will moderate these questions at the end. So jumping into our first agenda item of welcomes and introductions, a big welcome to all new and returning attendees alike that have joined today. Briefly, for new attendees, these webinars connect jurisdictional leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health. If you are not already on our distribution list, I invite you to get on our list, stay up to date with our events. Our first presenter is Dominique Boston. Dominique recently joined Infoway as one of our nursing champions. While in this role, she continues to work at the Hospital for Sick Children, where she has filled various nursing roles over the past 6 years. Today, she will share her frontline experience with digital health technologies. The floor is yours, Dominique, when you are ready.
Thank you very much. Okay, so hi everyone. As mentioned, I am Dominique Boston, and today I'll be talking to you about digital health technologies within nursing and bring forth to you a nursing perspective. So just a little agenda today. I'll have a brief introduction, discuss some of the digital health technologies that I utilize in my practice, talk about some of the benefits they bring to my workflow and patient outcomes, then discuss some of the barriers that exist amongst digital health technologies we currently use, and then lastly, touch upon a few factors that are important for a successful implementation and adoption of new digital health technologies amongst nurses. Okay, so a little bit about me. I'm a registered nurse, and my background is mainly in acute care. I'm a pediatric nurse who specializes in plastic surgery, urology, and burns. And I also have some experience working in ambulatory care, where I supported multiple specialty surgical clinics. Most recently, as mentioned, I joined Canada Health Infoway as a nursing champion. And within this role, I provide a nursing perspective to some of the current initiatives that are geared towards making our Canadian healthcare system interoperable. Okay, so digital health technologies, they refer to tools, systems, or devices that can generate, create, store, or process data to improve health. Currently, as mentioned, I'm working at a hospital, and these are some of the primary digital health technologies that I utilize. So the first one being an electronic medical record. So what this is it's an electronic version of a patient's chart. So it captures all the care that is provided from a single organization on a computer system. The next one that I utilize is a clinical decision support system. And what this is a tool. This is a tool that is within an EMR, and it allows our providers to have some support in the decisions they make. So it use predictive analytics that prompt providers. So for example, if I'm inputting some vital signs, it might let me know those numbers aren't looking too great, and it'll provide some recommendations on some interventions to follow. Or maybe if the medication I'm administering is being given too soon to a previous dose, it will let me know that I should wait a little bit. The following one is an electronic health record. And the difference between this one and an EMR is it looks to capture a patient's entire health. So it was designed to be used by multiple care providers and organizations, and it has the ability to integrate information from other areas. This one I would say I utilize a little bit less often, just because sometimes some of the information that is available is a little bit less consistent. And then lastly, the use of medical devices. So things like vital signs machines and blood glucose testing devices. So what are some of the barriers? Well, there are lots to utilizing digital health technologies in nursing. So with the use of an electronic medical record, I'm able to have a comprehensive view of a patient's medical history. Just within a few clicks, I'm able to see patients' medications, their lab results, some medical notes, surgical history, previous care plans, or even current care plans, and the list goes on. Because I have all this information available at my fingertips, I'm able to make informed decisions. And that information that is within the electronic medical record helps enable those clinical decision support tools that I touched upon. And then additionally, if I'm documenting within a system, we are able to collect information on the care that is being provided. And this is what ensures we are promoting improved patient outcomes. So this is what drives our quality improvement. Additionally, it helps our care be more timely. If all healthcare providers have access to the patient's health history, we're spending less time trying to gather information from other areas where care was provided, and ultimately more time is spent with patients. And then there's also seamless transition of health information. So if we are all available, all healthcare providers are available to access a patient's health history, then the communication is improved and it facilitates coordination. So for example, it reduces the amount of time providers and patients have to repeat their stories. And it also reduces the chance of information to be missed or not included, so the care we're providing is safe and efficient. And then lastly, the use of digital health technologies helps empower patients and their caregivers. So a big part of my job as a nurse is to ensure patients are able to access care they deserve and to educate them on the care they're being received. So being able to access an online portal allows patients to be involved in the care, have a better understanding of the diagnosis and maybe their medications. Additionally, the use of virtual care helps reduce any barriers patients might face when accessing care. So things like having to take time off work, or maybe a lengthy commute to a certain clinic, or having to find someone to look after their children while they attend their medical appointments. Although there are many benefits to digital health technologies, there are barriers amongst the ones we are using right now. So within the current healthcare system, there's a mix between the use of paper and electronic medical records. And additionally, if electronic medical records are being utilized, they aren't connected, therefore they are unable to speak to each other, and this leads to a fragmented healthcare system. So the fragmentation of our healthcare system is one of the main barriers that creates multiple challenges for nurses as well as patients. Often, nurses spend a lot of time trying to gather information from other sites to build that patient's health history. And it can take a lot of time to make sure that information we've gathered, we are updating into their patient chart. So this can lead to administrative burden and also delays in care. If unable to obtain that health history, if we don't have the time to because of high patient volumes, it can also lead us with an incomplete patient health history. So we don't have all the details that might have followed a patient during their care journey. And then if care is being provided on paper or across different electronic medical records, it can be challenging and time-consuming for patients to retrieve their own personal health information, as they must retrieve that information across different areas where they have received care. And then lastly, it is difficult for healthcare organizations to collect clinical data if the documentation of the care provided is inconsistent, making it a bit more challenging for us to assess the quality of the care that is being provided. So I just have a few clinical scenarios to make sense of those barriers that I touched upon. So in an acute setting, which is a bit more of like that bedside nurse setting, one of these examples, if a patient is being transferred from another hospital that's using a different electronic medical record, then they are often transferring that patient with a lot of papers that have the documentation of all the care that's provided. So once arrived, it's my duty to go through those papers and make sure all that information is updated into our electronic medical record. So it can be quite time consuming. And then if a patient is admitted, maybe not from another hospital, it can take a lot of time to gather all that health history, and sometimes challenging for patients to know details of the medication that we as healthcare providers require. So things like the name and maybe the dose of the medications they're receiving. When looking at an ambulatory care setting, which is more of a clinic setting, as a nurse, I spent a lot of time calling other clinics to gather reports. So things like maybe medical imaging reports. If I didn't receive them in time, or if additional testing needed to be done, then that led to further appointments for the patient. I often used a fax machine, which is silly to hear in 2024, but yes, we're still using them in healthcare. And then additionally, as patients coming into a clinic, those visits are a bit shorter. It was a bit time consuming to update the patient charts. So as this is an exciting time where digital health is improving our healthcare system, it's important to consider nursing as we move forward and continue to implement these digital health technologies. Nurses are the largest workforce in the healthcare setting, hence they have a critical perspective and view for the delivery and for maintaining patient safety, making it really important to include them in the implementation of any new digital health technology. So things that can be done to support them is providing them with education and training before and during the implementation, ensuring nurses understand the benefits of this new technology for their workflow as well as our patient outcomes. Involving them in the implementation helps ensure that the digital health technology will be beneficial for their specific setting. Providing them with supportive resources is important for them to be able to refer back to as new clinical scenarios emerge. And then lastly, ongoing assessments of this implementation to make sure it is not making more of a burden and benefiting nurses, as well as patients. And then just to finalize, I talked a lot about how this helps our nursing workflow, but ultimately it helps improve the care that we are providing to our patients and ensuring patients receive the best care and the most appropriate care is at the core of what we do as nurses. So thank you very much for listening to my presentation.
Thank you, Dominique. Wonderful presentation. Thanks for sharing your experience with us. To now introduce our next presenter, Dokter. Chris is a clinical informatics manager with Vancouver Coastal Health. Chris has supported the implementation of electronic health record system across several Vancouver Coastal Health sites, the Provincial Health Services Authority, as well as Providence Healthcare. Today, Chris will share his insights on the upcoming trends in nursing technologies from an informatics perspective. Take it away, Chris, when you're ready.
Thanks, Therese, and thanks, Dominic. I'll just share my screen here. There we go. Good morning or good afternoon, everyone. As Therese introduced myself, I'm Chris Dokter. I'm a clinical informatics manager from Vancouver Coastal Health here on the West Coast. Contrary to my last name, I'm a nurse by background. I was doing bedside for about 5 years on an acute neuroscience unit. I've had turns in doing some contact tracing as well as discharge management. And I'm relatively new to this manager role, but I've been part of the clinical informatics team now for almost 3 years. And it's my privilege to be here today to present on the topic of upcoming trends in nursing technologies from our health informatics perspective. Now, before I jump into it, I just want to do a quick land acknowledgement. I'd like to acknowledge that Vancouver Coastal Health is situated here on the shared traditional homelands of the Coast Salish peoples, including Musqueam, Squamish, and Tsleil-Waututh nations. I'm truly grateful to be able to work, live, and play on these unceded lands, and encourage you to all recognize the lands on which you live and play. So as Dominique alluded to, I'm just going to get the biggest one out of the way here first, and that's our electronic health records. When I first started nursing back in 2011, everything was still done on paper, and health informatics was barely a blip on our nursing curriculum and more of a concept, really. Fast forward to today, and you'll just see how many different health organizations are adopting electronic health records to help improve the safety, quality, and consistency of patient care. In our region, we first started implementing our electronic health record, which is CST Cerner, back in 2018, and we've continued to expand across clinics and facilities year over year. It's been a joint initiative across 3 of our major health organizations, and it's now used at over 40 facilities and 450 clinics, encompasses over 4.1 million patient records and over 42,000 active users. You might notice a bit of a pattern in my presentation as we get into our next trends, as the electronic health record is really the basis for many of the trends in technology and informatics that we're continuing to grow. So the first of these trends I'd like to talk about is automation. So nursing and healthcare in general, we know that best practice often follows standard protocols and guidelines. Often these guidelines follow fairly linear pathways that essentially boils down to if X, then do Y. So the electronic health record now makes it possible to automate many of these tasks to help improve efficiency and allow nurses and other healthcare providers to focus on other more important and complex tasks. So these are just a few examples of how automation is being used in our system, and it might differ from system to system, but for us, we use it for automating consults. So for example, anytime there's a positive result for an infectious disease, or if a patient identifies infectious disease risk factors on their admission questionnaires, infection control practitioners are automatically notified for a consult and follow-up, and the system automatically places appropriate isolation precaution orders for them. So not only does this help ensure that patients are isolated early and minimize potential exposures, it also helps focus and streamline our ICP's workflows. Next area where we might see some automation is with our bedside medical device integration, or BMDI. While continuous bedside monitoring isn't new, especially in our critical care areas, the BMDI systems allow vital signs to be pulled directly into the patient's chart, and additional layers of functionality within the system allow us to recognize early signs of sepsis and generate alerts to nurses and providers for immediate follow-up. And finally, another example of how automation can help improve other workflows is with our pharmacy. So Gravol, Benadryl, and bowel protocol medications alone can make up over 15% of all medications requiring verification by a pharmacist. So that's a lot of time spent reviewing relatively low-risk medications, taking into consideration things like who is placing the order and how they're being placed. We can now use pre-programmed logic within the system to auto-verify some of these low-risk medications in order to free up time of the pharmacist to focus on medications that might pose a greater risk. The next one I'd like to speak about is how new technologies are allowing us to explore new and exciting ways to provide care that were otherwise impossible before. For this, I'd like to use BCH's Hospital at Home program as a prime example. While providing care to patients in their home isn't a new concept, access to an electronic health record along with other advances in healthcare technologies now allows us to take care of highly acute patients at home that previously could have only been managed in a hospital setting. Shared and remote access to the EHR is just one aspect that makes this level of care possible. We're also now bringing the BMDI, or the bedside medical device integration that I spoke about earlier, directly into the patient's home and setting up remote monitoring systems that can be used to observe the patient. Vital signs can be measured and recorded remotely directly into the patient's chart, and virtual status board is used to allow clinicians to view all of the latest information for their patients at a glance. Care can be provided to these patients 24/7 with a combination of in-person and virtual visits by our team of nurses, doctors, and allied health professionals. And you might even be wondering what happens if the patient needs something between visits. In those cases, we built out a virtual call bell that the patient can press, and somebody will respond to that in the system just like they would in hospital. So thanks to these new technologies, the level of care that can now be provided in the comfort of the patient's home is really nothing short of amazing, and provides many benefits for the patients, healthcare teams, and the healthcare system in general. And that gives us a good segue into our next trend, using technology to strengthen the way we collaborate. So one of the biggest benefits of the EHR that I spoke about earlier as well is that it's available access from anywhere, really eliminating the need to be on site and wait for your turn to view the patient's chart. Having all that information at your fingertips at any given time means that care can be a lot more dynamic and responsive. Highlighting again an example from our region, a great example of how the EHR is helping to strengthen collaboration can be seen in our eye care rounds or interdisciplinary care rounds. PTs, OTs, physicians, and several other allied health professionals can now document in real time, and their care plans can all be viewed from one central document, making it a lot easier to determine the patient's overall care needs and any potential barriers or challenges to discharge. We were recently honored to have these benefits called out in our local health authority news, but I'd like to also give a quick shout out to all our informatics team that helped to launch this one. And finally, I'd just like to speak about a few other things coming up on the horizon. While some of these might not be fully implemented yet, the potential is definitely there and is actively being explored. First one I'd like to talk about is the patient portal. So the patient portal is a platform that would allow the client to be more involved with their care and to better connect them with their healthcare teams. This patient accessible platform has the potential to allow the client to view all appointment information, directly message their care teams, review and update contact information, review and update home medications and allergies, and even view discharge documentation and handouts. To link it to our hospital at home program, which we talked about earlier, it can also help support patients and their families to do things like documenting their medications and completing them on the MAR, documenting vital signs if the patient isn't connected to continuous monitoring, to see who and when the next clinician visit will be with, and to review care orders that can be carried out by the family, for example, diet orders. And finally, a presentation about emerging healthcare technologies wouldn't be complete without at least mentioning artificial intelligence. So AI applications in healthcare isn't a new concept, but it used to be more of a sci-fi concept, and now it's becoming closer and closer to reality for many sites. So AI has the potential applications for healthcare to potentially include diagnostic interpretations, triaging and decision support, documentation, and even providing autonomous care. Though we might be closer to utilizing AI scribes to assist with documentation than we are to having robots take over our surgical suites, the potential is certainly exciting, and I look forward to seeing how this continues to evolve. That's all I've got for you today. So thank you, everybody, for listening.
Thank you, Chris. Lovely presentation. Just a reminder to the audience members, if you have any questions, please feel free to submit them through the Q&A feature on your toolbar. We will be trying to get through all of these at the end, if time permits. So now to introduce our final presenter, it's Infoway's Waldo Beausejour. Waldo is a senior research specialist on Infoway's performance and analytics team. Here he will be discussing the results from the 2023 survey of Canadian nurses. Take it away, Waldo, when you are ready.
Okay, thank you, Therese. Let me go ahead and share my screen and then switch to presentation mode. Hi, everyone. Thanks for joining this presentation today, this webinar. Now, let us commence with something that you all know. Nurses represent the largest proportion of health workers in Canada. I know Dominique mentioned that earlier. And alongside other clinicians and healthcare professionals, our nurses have been at the forefront of the COVID-19 pandemic, playing a critical role in patient care and the overall response to the crisis. So I want to take this opportunity to express my heartfelt thanks to them. Now, as the Canadian healthcare system embraces digital health technologies, you might be wondering how these technologies are utilized by nurses in Canada and integrated in nursing practice. And these are important questions, whether you are a nurse, a healthcare professional, a policymaker, or a patient. My name is Waldo Beausejour, and I'm a senior research specialist at Infoway. Today, I will walk you through some key stats and findings on the use of digital health technologies in nursing practice based on data from the 2023 Canadian Survey of Nurses. And throughout the presentation, we'll cover a variety of topics. We'll start off with nursing practice in digital environment. We'll try to we will start by examining how nursing practice is evolving within today's digital landscape. Number two, we'll talk a little bit about clinical interoperability and communication, because in this digital environment, we will delve into the current state of clinical interoperability and communication, focusing on how nurses collaborate with other health professionals. Number three, the role of AI. I know the previous panelists, they mentioned the role of AI in nursing care. As artificial intelligence gains momentum and permeates nearly every sector, it is timely to explore its integration into nursing practice. And lastly, we'll talk about barriers and challenges. We'll explore some of the barriers and challenges that nurses in Canada face when accessing and using digital health technologies. The results I'm about to present are based, as I mentioned earlier, on the Canadian Survey of Nurses. This is a cross-sectional survey that gathers detailed information about current states of nurses' ability to, current state of nurses' use of digital health technologies across care settings, Canadian nurse abilities to access and exchange patient information seamlessly, clinical systems used by Canadian nurses to document and retrieve information, and lastly, benefits and barriers related to the adoption of interoperability by nurses in Canada. Now, the survey is commissioned by Canada Health Infoway and conducted in collaboration with the Canadian Nurses Association, the CNA, and the Canadian Nursing Informatics Association, the CNIA. The survey is carried out by a third-party vendor. In 2023, we partnered with Léger for this purpose. We achieved a sample size of over 1,900 nurses in 2023, with more than 1,200 of them providing direct patient care, and the majority of our respondents were members of the CNA and CNI. This table shows the breakdown of the total sample by provinces and territories. If you look at the row labeled unweighted, you will see that Alberta accounts for a quarter of the total sample size, followed by Ontario, 23%, and BC at 15%. And these three provinces represent the largest portions of the sample. And the row labeled weighted shows the sample distribution after applying weights. And all the stats presented in subsequent slides are based on these weighted samples. Now, the first topic we'll explore is nursing practice in digital environment. But before we dive into the results, let me provide a little bit of context. We've conducted 4 iterations of the nurses survey, 2014, 2017, 2022, and recently 2023. So the 2020 iteration, which was conducted a few months before the COVID-19 pandemic began, serves as our pre-pandemic baseline, right? Now, in March 2020, the World Health Organization declared COVID-19 a global pandemic, and we all witnessed the rapid digital transformation within the Canadian healthcare system during this period. Now, in 2023, 3 years after the pandemic's onset, our survey offers a glimpse into the integration of digital health technologies in nursing practice in what can be considered a post-pandemic, or if you will, a pseudo-post-pandemic context. Now, let's start with patient record-keeping systems. The chart shows a steady increase in the use or in the access to fully electronic record-keeping systems by nurses in Canada, EMRs. So in 2023, we are sitting at 38%. So 38% of nurses in Canada reported access to an EMR, up from 27% in 2020. And when it comes to access to EHR, we are sitting at 54%, up from 47% in 2020. Now, if you, access to EMRs and EHR is crucial for nurses. If you ask me why, well, patient care is enabled by information, right? Now, besides accessing EMRs and EHRs, nurses need access to other digital assets at their main care settings. And this slide provides a list of electronic functionalities available to nurses at their main practice setting. If you look at the first row, it's a pretty long list, but let's take a look at the first row, communication to other health professionals within their organization, which we will refer to as interoperability. So 75% of nurses reported that they can communicate to other health professionals within their main care setting. And the last row that I highlighted for you, now you're familiar with this one. This one is access to provincial and territorial patient electronic health records systems, EHRs, and 54%. You've seen this number in a previous slide. Other electronic functionalities they have access to. And we have another long list, but I want to highlight a couple of them. Number 2, communication to other professionals outside my organization, which is interoperability, right? Transfer of patients' health information securely to other health professionals. For the first one, we are at 44% of nurses who are currently using this. And for transfer of patients' health information securely to other health professionals, we are at 39% in 2023. And I've highlighted these two guys because they relate to interoperability. Now, moving on to digital or electronic or technological needs. When we asked nurses how essential it was for them to access these technologies, the answer was 73% of them reported that it is highly essential and moderately essential to access a mobile device to communicate or to collaborate with team members, make clinical decisions, and document patient information. And then for speech recognition software to provide and document patient information, 21% of the nurses we surveyed reported it is highly essential or moderately essential. So combining the 12% with the 10%. Connected care and clinical interoperability. One of the main priorities of for Canada Health Infoway, if we look at our shared Pan-Canadian interoperability roadmap. Now, let's start with electronic clinical communication. You've seen the 39% when I showed you the slide about the functionalities nurses have access to. Now, this one is about the trend. You can see that there is overall access to or electronic clinical communication or the ability for nurses to electronically transfer patient clinical health information securely to other professionals is trending upward. We were at 24% in 2014 when we had our first survey, and now we are at 39% in 2023. And another important indicator, which is ability for nurses to exchange patient clinical summaries with HCPs outside their practice, which is a bit different from the one that we have trended in here. This one, there is no trending available because we started collecting this information in 2023. And we are at 24%, so 24% of nurses can exchange patient clinical summaries with HCPs outside of their practice. Now, if you are curious to compare the nurses with the physicians, we'll have another webinar in October. We'll show the results for the physicians. But for now, let's hang on to the 24% for our nurses. Now, confidence with access to all health information needed. 60% of nurses reported that they are very confident or somewhat confident in having access to all the information needed about a patient to plan and provide the best care. 60% of our nurses. For access to patient information from outside their practice, on the left-hand side, we have the average percentage of patients for whom nurses needed to access health information collected outside of practice setting, 44%. This gives us an idea of the demand for external information, and it relates to interoperability. And on the right-hand side, we have the time they spend beyond what should be what nurses feel should be spent searching for information outside of their practice, and they are spending 60 minutes on average. 60 minutes. That's time taken away from direct patient care, right? Because they are using this time to do to collect information or to search for information. And again, if you're curious to know what was the results for the physicians, you can wait until October when we have our other BE Network webinar. Now, care coordination. This one is more about, we've seen exchange of patient information. We've seen transfer of patient information and everything in previous slides. This one is about the settings that receive the information that are being transferred or communicated outside. And as you can see in here, primary care or family medicine offices, they absorb the majority of the information. 49% of them are receiving the information that are being transferred electronically outside, followed by specialist office, 34%, and then community office, community health center, 32%. Same for nursing home, long-term care setting, and facilities, 32%. Now, personal input on digital health technologies in primary care setting. This one is really important because we want nurses to provide their input so the tools that they are using, that they have something to say about the use. They participate in the design of the tools. And as you can see in here, when it comes to their personal input on digital health technologies, 16% of nurses provided their input when it comes to usability of the system. 15% reported they were able to provide their input when it comes to dashboards, access to support monitoring and evaluation of clinical outcomes. So we have pretty low percentages when it comes to their input to these technologies. Hopefully, they will be given more opportunities to provide their input. Now, moving on to the next slide, which is about AI-powered technologies in nursing practice. I know Chris touched on this, Dominique talked a little bit about this, but this one is about the results from the survey. The first thing is about use of AI-powered technologies in nursing care. On the right-hand side, we have how AI is being used. 15% of nurses reported that it's being used in clinical decision support systems, medication management, predictive analytics, personalized care plans, 11% just to cite those that are on the top of the list. And on the right-hand side, on the left-hand side, we have the proportion of nurses who reported that AI is being used in any setting they provide care. We know that it's pretty low given the use, the momentum in AI. Potentially will need to improve the way we ask this question, because when we discuss it with some nurses, they realize that this could be this may not be a good representation of the current landscape. So moving forward, we'll need to improve the way we collect information around AI. Now, perceived benefits of AI for healthcare and nursing practice. So we collected a list of statements. So the first one is AI will have a significant impact on healthcare in the future. So 61% of nurses agree with that. They strongly agree or moderately agree. 51% agree that AI can reduce the time spent on admin tasks, and we've seen the amount of time they spent searching for information outside of their practice, 60 minutes on average. 53% reported that AI or agreed that AI-based technologies can improve care planning, and 47% strongly agree or moderately agree that AI can be used to reduce medical errors and provide safe care. So we've seen some of the benefits. Now, what about the problems? Some of the problems perceived by nurses. The number one is loss of human interaction with healthcare. 83% of nurses feel, they said that it's very concerning or somewhat concerning. And when it comes to data security and privacy, 81% of nurses reported this as a concern. Concerns related to medical liability, 78%. And then lastly, concerns over negative impacts to patient relationship, because we know nursing is a relationship thing. We've seen benefits, we've seen problems. Now, what are the priorities? What are the perceived priorities to support AI use in nursing practice? And to answer this question, we collected a list of statements from the nurses, and the first one was appropriate training and education for nursing workforce around the use of AI. 77% of them see this as a priority, a very high priority or somewhat high priority. 74% of our nurses reported that appropriate regulatory and accreditation system for the use of AI-based technologies or solutions as a very high priority or somewhat high priority. And when it comes to policies and guidelines, 73% of nurses regarded this as a very high priority or somewhat high priority. I mean, policies and guidelines from governments, clinical bodies for the integration of AI technologies. And last on the list, not the last, we'll just cover this last one, organizational readiness to effectively incorporate AI into practice. 72%. We've seen training. Now this one is more about organizational readiness. 72% of nurses reported that this one is a very high priority or somewhat a high priority. The last section that we'll cover is about barriers and challenges to digital health technologies for Canadian nurses. So we've divided this into two types of barriers, starting with technological barriers. So on top of the list, we've seen that nurses reported multiple logins. 39% of nurses reported multiple logins required to access different clinical information systems as a problem, as a barrier. So digitization is important, access to digital tools is important, but when they have to go through different systems, that could be a barrier according to the nurses. Integration with current systems, having multiple systems that aren't connected, 34% of nurses reported this as a barrier. Lack of available equipment, we've seen the needs before for some equipment and technologies. So 30% of nurses report this as a barrier. Clinical information systems are very complex and not intuitive, 24%, so that's why it is important. So we get the inputs of our nurses. We've seen earlier that we had very few percentages for nurses when it comes to their ability or the opportunity for them to provide their inputs. It takes too long to sign in and use the systems, 23%, too many workarounds required to use system, 23%, and unreliable network connection, 21%. And the last one we are going to cover is the use of systems does that align with clinical workflow, 21%. We want good technologies. We want technologies that serve our clinicians. We don't want them to be barriers. We want them to integrate with their workflow. Now, for some of the admin, financial, and other barriers, we have a few items. The first one is a nurse roles require use of both paper charts and electronic records. So 38% of nurses reported this as a barrier. Differences between health disciplines, some use paper and others use electronic records. 32% of nurses reported this as a barrier. Too many other work demands, 30%. Lack of appropriate training, 25%. And then lack of ongoing support, 24%. That's pretty much some of the barriers. Now, what I want you to walk away with, the first thing we covered was nursing practice in a digital environment. 38% of our nurses used EMRs only in 2023, up from 27%. Here we are saying only because we also, the survey also revealed that there is a pretty large proportion of nurses that are using hybrid systems. Hybrid systems refer to the combination of electronic systems with paper charts. But for electronic only, 38% of our nurses have access to EMR, and 54% of nurses had access to provincial and territorial EHRs in 2023, up from 47% in 2020. Now, when it comes to connected care and clinical interoperability, 39% of nurses could transfer patients' clinical information securely to other healthcare providers outside of their practice. 24% of nurses could electronically, not including fax. I know Dominique mentioned fax, that some nurses are still using it in 2024. So this one does not include fax. So 24% of nurses could electronically exchange patient clinical summaries with HCPs outside their practice, two different indicators, although they relate to the same thing. AI-powered technologies, 6% of nurses report AI being used in their care settings. 38% of nurses are comfortable with AI use in healthcare. And for the barriers, the top one was multiple logins required to access different clinical information systems, 39% of nurses. Integration with current or multiple systems that aren't connected, 34%. And these were some of the technological barriers that our Canadian nurses or nurses in Canada are facing. Now, in terms of conclusion, so the results revealed that a significant and growing majority of nurses who are providing direct patient care through a variety of electronic record or clinical information system functionalities. And at the same time, a majority of nurses believe improved interoperability is perceived to be beneficial to nursing practice, as it can improve their access to complete patient information, enabling better coordination of care with other providers and enhancing communication with healthcare providers outside their practice. So that's pretty much all I've got for you. Thanks for your attention. Back to you, Therese.
Thank you, Waldo. Wonderful presentation. So I'm just going to go ahead, share my screen once again. So we are going to go through Q&A. However, while we are going through the Q&As, I'm just going to encourage everybody to check out our Insights website. Our performance team has worked to put all our data and survey information in one place. So if you have some time as we wrap up the presentation with a few questions, to scan the QR code and go have a look. Okay. So onto the questions. There are a few questions that have been dropped in the chat for the the panelists. Waldo, would you be okay with reading them? I can't quite see them on my screen here while sharing.
Let's see if I have access to them. I think I only have access to the chat. I don't see the questions.
I will go
Oh,
ahead
okay,
and-
Q&A.
Yeah, there's a few in the chat. I can go ahead and read the chat if
Okay, I
come
see
up,
it.
so. Okay, so the first question would be, I think, for Chris and Dominique. It's about how do you both feel your professional associations have been able to support your work in digital health technologies? Example, approval of digital health work as nursing hours and the like.
Yeah, great question. It is a bit tricky, I would say, as a nurse. We are oftentimes provided with some resources or maybe information, but it is the expectation that we review it on our own time or maybe while we are working. And while we're working, we're typically providing patient care. So we try and kind of squeeze it in between our tasks, or if we have a little bit of downtime, but healthcare is super unpredictable and things change all the time, and sometimes you have to kind of add a patient to your list and your day gets a little bit busier. So taking that time to be able to review and understand the new digital health technology is a bit difficult. Yeah, it would be beneficial if there was like maybe a bit of time assigned to be able to review everything. And, you know, nurses are at the forefront of providing that hands-on care, and we spend a lot of time with our patients so we can understand their needs. So nurses often have some great innovative ideas. It's just finding ways to give them support to be able to enable them. And when it comes to digital health technologies, maybe utilize them to their full potential.
Thanks, Dominique. And I see Miranda asked a second question there. So she's asking both about a professional association supporting work in digital health technologies, for example, approval of digital health work as nursing hours, as well as how did the panelists feel about the current landscape, for example, barriers and opportunities in hospitals and organizations in supporting nurses to be in roles related to digital health technologies and informatics. So I can answer both of those questions from our perspective. So keeping consideration that this is BC, Vancouver Coastal Health, our regulatory body is the BC College of Nurses and Midwives, and we're under the BC Nurses Union over here. Our health informatics specialists, we are a fairly large team. We are, the majority of our team are nurses, but we also have some allied health professionals. But while they're working as clinical informatics specialists, they are in their unionized positions. So their hours are still counted towards their regulatory hours, and we're able to report those to maintain our license. So I would say from our perspective, it's fairly easy, even working in health clinical informatics, to maintain those hours. And we definitely feel like we have that support, that this is considered still a nursing role, even if we're not clinically at the bedside. We're still supporting a lot of those bedside and clinical decisions in our work.
Thank you, Chris. Okay, this next question is for you, Waldo. It says, this is from Wahab. It says, could I get your survey and could the survey instrument be shared for replication in a different setting, such as in Africa?
Well, first of all, what is showing now on the screen, you can go to this website to get more insights into the survey methodology. I think we do have some information around the survey tool, but you can contact us directly from this website, and we can see how we can make it available so for the general public. But for now, we do have the raw data set available on Dataverse, where you can go and access, or if you want to run more in-depth analysis.
Okay. So those seem to be all the questions we have for our panelists today. Thank you, Dominique and Chris, for sharing and being guest presenters for this webinar. We hope to connect with you guys in the future. Just a heads up to everybody on the call that our next BE network is set for October 30th. We have been able to confirm Dr. Kathleen Ross as a guest speaker, where she will be discussing the CMA physician survey results with us. And the final report for that survey will also be available shortly the week of September 9th. So just stay tuned and stay connected to what we have going on. And as previously shared at the beginning of the presentation, feel free to join the mailing list so you can stay up to date. So thank you, everybody. Hope everyone has a good rest of your day, and we hope to be in touch very soon.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.